My name is Dr. Leon McDougle, President-elect of the National Medical Association, representing the collective voice of 45,000 African American physicians. On behalf of the NMA, I'd like to extend my condolences to the families and loved ones of persons who passed from the coronavirus. I'd also like to thank the Jackson family for their long-standing commitment to social justice and peace. And, oh, by the way, I still have my 1988 Keep Hope Alive t-shirt that I purchased during Reverend Jackson's presidential campaign visit to the Ohio State while I was in medical school. Let us begin. My talk is entitled From Katrina to Coronavirus. What have we learned? As I view the reaction to the coronavirus unfold in the United States, I'm reminded of lessons learned during the 2005 Hurricane Katrina and how the failure of infrastructure, otherwise known as the levees, resulted in more harm to the public than the initial damage caused by landfall of the hurricane. Let's fast forward to 2019. Just as the National Weather Service tracked the impending strike of Hurricane Katrina using satellite imagery, the National Intelligence Agency, Centers for Disease Control, and the World Health Organization were tracking the impending strike of coronavirus on the United States and the world. Hurricane Katrina revealed cracks in the levees, and the coronavirus has uncovered cracks in our public health infrastructure and national emergency management system. Where is the U.S. Director of FEMA? Where is the Director of Homeland Security? Where is the Director of CDC? What is the federal plan for response to local and state authorities being overwhelmed by coronavirus? Another commonality between Hurricane Katrina and coronavirus are the populations most affected in the United States. Inner city, high-density populations with higher percentages of people of color and the poor. The wake of the flooding from the failed levees, and in this case, the failed federal response to coronavirus, has placed lives at jeopardy and resulted in untimely deaths. Do you remember the chaos during the aftermath of Hurricane Katrina, where state troopers prevented citizens of New Orleans from crossing the bridge to a nearby parish in the name of safety and protecting that community? Now let's fast forward to March 2020 with governors of Rhode Island, Kentucky, Florida, and New Mexico having placed restrictions on travelers from, guess what, Louisiana, New York, Colorado, and other states requiring self-quarantines for 14 days, and those persons who fail to self-quarantine face the possibility of forced isolation or quarantine. What says FEMA and Department of Homeland Security? What says the CDC? Where are the coronavirus testing kits to enable data and reason to drive decision making? What's the national plan for mass production of personal protection equipment? What's the national plan for ramping up ventilator production? Lastly, with the national economy being placed at the epicenter of this public health crisis, it's an affront to the African American community and minority-owned businesses to learn that the United States Department of Labor has suspended affirmative action guidelines following passage of the largest stimulus package in U.S. history. I'm advocating that you please contact your U.S. congressional representatives, as I have, to inform them that this suspension must be rescinded. Small businesses are the engines of economic vitality within communities of color across the United States. In closing, I ask the question, from Katrina to coronavirus, what have we learned? Happy Resurrection Day. My name is Leon McDougle, President-elect of the National Medical Association. Thank you for your time.